Hello, everyone. My name is Dianne Kaler. Welcome again to the NTI PodTalk. And we have such fabulous conversations on this PodTalk. We get to talk about we get to talk to students and graduates and instructors and people within the NTI community. And then also we get the opportunity to speak to people outside the NTI community who are passionate about health and nutrition and holistic wellness. And today is no exception to that line. We are talking today to Dr. Sam Berne, who is a holistic eye doctor who talks about holistic wellness in the concept of vision and nutrition that's important for vision and also other holistic things. So I am so excited to talk to Dr. Sam today. I actually have been to see Dr. Sam in person in his yurt. You've got your yurt there. Or no, it's not a yurt. It's a, what is it? An octa something?
Geodesic dome.
Yes, there we go. Yeah, geodesic dome. Anyway, so thank you so much, Dr. Sam, for being here. I know that our listeners and our community are going to really enjoy this conversation. So thanks for being here.
Hey, thank you for having me and all the great work you're doing. So we're going to have some fun today.
Yeah, thank you. So first, I think it would be helpful for people to understand kind of what your conventional training and background in vision care is. And, because obviously you have a conventional training, and then we'll get into kind of how you grew in your understanding and got into more holistic vision care. So let's talk about your conventional training.
Okay, well, great. Thanks for being here, everybody. And I hope I can offer some value to you today. So my career started very early on, and I was 8 years old and I had a learning disability, and my mom took me everywhere, couldn't help me. Ended up at an eye doctor's office, and he gave me a pair of nearsighted glasses, and my eyes just got progressively worse until I enrolled in optometry school. I had studied a lot of chemistry undergraduate. I was a chemist and also did a lot of classes in humanities because I wanted to be balanced if I was going to go become a doctor, to know some things in liberal arts and foreign languages. Anyways, I went to the Pennsylvania College of Optometry in Philadelphia, and at that time it was probably number one or number two as the most medically oriented optometry school, very allopathically focused. But I had the good fortune to get to do some internships in that program, and one of them I chose was going to a holistic optometrist in San Diego, and I worked in his clinic. His name was Bob Sannett, Dr. Bob Sannett. And it was a practice where we devoted to help kids and adults with vision problems using a process called vision therapy. And it was inspiring to work with Dr. Sannett. And so after I graduated optometry school, I enrolled at a place called the Gesell Institute, and it was affiliated with Yale University, and it was started by Arnold Gesell, who was a physician in the late 1940s, and it was focused on child development. And so when I went there in the late 1980s, it was being run by a group of holistic optometrists, and I spent a year there learning how to evaluate and treat children with the spectrum disorders. Now, back then it wasn't really called spectrum disorders, but it was the same thing. So then I opened a practice up in Philadelphia, and it was more holistically minded. I actually apprenticed with a holistic eye doctor in Philly, and I couldn't get any patients. It was really a hard time. So I went to a couple of the hospitals, and I volunteered my time to help people with traumatic brain injury who'd been in car accidents, sports injuries, and they'd been written off by the conventional eye doctors, but I did this kind of physical therapy with them, and of course really impacted them positively and I was able to get a contract at about 3 hospitals in Philadelphia, which was unheard of back then, but I did. And then I also focused on special needs kids. I worked with them, that community, because it was another community that eye doctors really didn't have an interest in. So I built up a very busy, successful practice in Philadelphia, and I sold it about 5 years later, and I migrated back out west to Santa Fe, New Mexico, which is where I am now. And I chose Santa Fe because one of my internships was at the Indian Hospital, IHS. And so I knew Santa Fe would be a great community that would support more of a holistic eye care approach. So I opened up a practice and got busy immediately. And then, many other things happen that we can talk about or not. But here I am today, 35 years later, and I'm going strong, more passionate than ever, and glad to share this information with people who are interested.
Yeah. So I am an avid listener to your podcast, and I actually can't remember how I stumbled on to hearing your podcast and learning about you and then coming to you as a patient. I really don't remember how all of that happened. But your passion definitely shines through in your podcast. And I love how you've started doing sort of snippets of your virtual appointments with your client, with your patients. And your passion is just truly evident, and the vastness of your knowledge is truly evident. So one thing that really attracts me to you and your work is that you talk about nutrition. And of course, as a nutrition school, anything having to do with nutrition and food is always really interesting to us. So, and that framework in which you talk about holistic vision care using nutrition is very rare in your field, at least from my perspective. And you can talk about, if you think it's also rare. But how did your training progress? Like you talk about so many different things. You talk about exercises, of course, and we'll talk a little bit more about that, and nutrition, and you talk about aromatherapy and all kinds of different sort of psychological things that are involved in vision. So where did you kind of get all of this additional training and interest? It's just fascinating.
Well, thank you for that question. It's really a great question. So I would say it started off when I met a holistic eye doctor when I was 28, and I went to him as a patient in vision therapy, and he said two things to me. He said, "Well, your left eye wanders out. That's why you see double sometimes. And you're very nearsighted, but I think you could reduce that. I think it's mostly tension related." So I went through his program for 6 months, and yes, my two eyes work together now. I'm an avid reader. My learning just has skyrocketed, and my myopia went away completely, 100%. I see 20/20 at distance and near. So I'm a test case. I walk the talk, and so that's one aspect. People meet me and they know that I'm not bullshitting them, that I'm actually living what I'm talking about. I had the good fortune of meeting about 5 behavioral developmental optometrists when I was in my early 30s and they were in their 70s. And I was like a sponge. I would go to all their meetings up in Connecticut. And so they passed on, all this wisdom to me that to this day, a lot of my content is based on what they taught me and what I applied. Now, the nutrition piece was interesting because when I started in Philadelphia and I started working with people, I wasn't as sophisticated as I am now. But I read a statistic that really, really inspired me. And it said that the eyes and the brain make up 2% of the body weight and use 25% of the food intake. So take a moment there and just digest that. 25% of what we eat is needed for our eyes to remain healthy.
Hmm.
And as you know in your work, one of the big issues is, well, what we eat causes inflammation, lack of dietary absorption. And when I started to dig into functional medicine, I was amazed at the connections between the internal lining of the gut and the internal lining of the eye, the retina, and how one mirrored the other. And yet it was never taught in any of our classes, and it was also not talked about at any of the meetings. So I think, again, social media, and we've become more sophisticated, and people like you with their programs, people are becoming much more conscious about what they eat and how it affects them. But since the eyes need such a high amount of nutrients, we have such a high concentration of mitochondria in the retina, just as an example, that what my question was, what can we do nutritionally to improve our eyesight? And so you have all these people with macular degeneration,
Mm-hmm.
cataracts, glaucoma, that if they just altered their diet, at the very least, it would neutralize some of the symptoms without having to do the laser surgeries or the pharmaceutical drugs. And so, as I studied more and developed more inside myself and talked to colleagues, I would consider myself more of a naturopathic eye doctor. And yes, over the years, I've studied herbal medicine, aromatherapy, craniosacral therapy, somatic therapy. And one of the places that really turned me on was when I became a faculty member at the Esalen Institute, Esalen and Big Sur. And Esalen was, at least, back in the 60s and 70s, there were a lot of amazing people that went there. Ida Rolf and Emily Conrad and, Gabriel Roth and so many others. Anyway, when I was able to teach there, I worked a lot with many different disciplines, body workers, functional nutritionists, trauma specialists. And so I became very adept at understanding a person's vision from a whole body perspective. And our eyes do carry our history based on, are we nearsighted? Are we farsighted? Do we have astigmatism? Do we have eye conditions, eye diseases? And so those things were a way into understanding that our eyes reflect our systemic, metabolic, and energetic health. And trauma, stress, toxicity can really deeply and profoundly affect how we perceive and how we see. And our eyes are one of our primary senses. And yet, in this culture, we're losing our vision on so many levels. So I'm kind of in a perfect place to be able to talk this way, even though on the professional level, there is still a lag where, the mainstream are still just talking about disease and pharmaceuticals. I do see some of the younger graduates are curious and they will reach out to me. And so there we are. So that's kind of it in a nutshell, how I got to where I am today.
Yeah. Well, that's really inspiring that you have younger people in the field who are coming to you to look, you are now becoming the mentor, like you had the experience with your mentors early on in your training. You're becoming the mentor for those young people who are interested. And I think it's fantastic. And I am always so amazed how people just don't recognize the full impact of, your food choices, your lifestyle choices, your movement, your psychology, stress, all those kinds of things, how they actually impact the, the experience of our body functioning. And that goes all the way to very small places like the vision, which the eyes are, a small mass of the body. But as you say, they use a lot of the energy, the resources, all that kind of stuff. So I'm just thrilled to hear that you've got people who are interested in it. I also am, it is so inspiring to hear you talk about how vision can be improved because, as you say, you go to a conventional eye doctor, which, they've got lots of training. They have lots of, they have a purpose, they have a function, but they prescribe glasses, and then that's kind of it. And then, they get into the surgeries and those kinds of things when vision problems become diseases. But they never talk about how vision can be improved. And without using glasses, without using surgery. And then, of course, as you talk about so often in your podcast, you get a prescription, and then 2 months later, 3 months later, 6 months later, you have to get a stronger prescription, and then a stronger prescription, because your eyes are constantly adapting. And what's not happening is that you are actually utilizing all of the functionality of your eyes and all the resources that are being put into vision to stop that progression and actually maybe get some improvement. So your personal story about how you essentially healed your vision impairment and now no longer need glasses is amazing. And I after coming to you, you gave me the exercises, all that kind of stuff. And I have not gotten to the point where I don't need to wear glasses at all, but certainly I have areas where my vision is obviously improving a little bit, but not to the point where I don't need glasses ever. But I'm working on it. I want to get there. So I'm just very excited about your whole everything you do and everything you talk about. So a couple directions that I want to go. I want to talk about some eye exercises, because I think if you could just give us an idea of a couple of eye exercises that you promote often and kind of have broad spectrum benefits, that would be beneficial. And then also some specific nutrients that you see being important for broad spectrum vision care. So either which way would you like to go? Which of those two things would you like to talk about next?
Why don't we do the nutrition piece first, and then
Okay.
we'll turn this into a mini workshop
Okay.
where I will give two exercises, and the second one is a relaxation one, so that might put people in a really great space.
Good.
All right, so in terms of nutrition, obviously one of the main ones is vitamin A,
Mm-hmm.
and people with dry eye or retina problems, vitamin A is essential, and are people even absorbing their vitamin A?
Mm-hmm.
And what are some other things that they can do? Like zinc is a trace mineral that helps vitamin A absorption. So that's probably number one on my list. Number two would be the carotenoids. These would be the red and the orange and the yellow, green vegetables. Specifically, the carotenoids are called lutein and zeaxanthin. These are very important pigments for the macula, protecting us against the damaging blue light, overexposure of ultraviolet from the sun. And so we get those from, a variety of our red, orange, yellow, green vegetables. So they're the plant-based carotenoids. And then we have the marine-based carotenoid astaxanthin, which is also really helpful on so many levels, preventing cataracts, reducing the risk of macular degeneration. And that either you can get through some healthy seafood, salmon is one possibility, or through a supplement, microalgae, that would be another. And then we've got some other ones like glutathione. Studies have shown that low glutathione levels, you can have a higher risk of developing cataracts. I would put vitamin C in that as well. And then we can go to some of the other things like bilberry and ginkgo, which are great for vascular health, especially for glaucoma and optic nerve protection. And the fats and oils are really important, reducing the risk of dry eye and optic nerve disease. And then finally, I would say that you need to eliminate sugar from your
Mhm.
diet, processed foods. Again, you could talk for hours about sugar and how
Yeah.
it's so negatively impacting us. So
Mhm.
those are some general broad brush. Some people like the Mediterranean diet. Some people with more severe diseases like diabetic retinopathy or wet macular degeneration may qualify for more of a ketogenic or keto directional diet. Some people
Mhm.
are into the intermittent fasting and those kinds of things. Those are a little more sophisticated. When I studied acupuncture, we know that the liver and the gallbladder rule the eyes, the liver specifically. So, anyway, we might do a liver tox or take better care of our detoxification pathways. That's going to help our vision and eyesight. So,
Mhm.
that's kind of just a general, broad brush for whether you're vegetarian, vegan, or you eat animal products.
Mhm.
So, that's my nutrition information. Now, in
Yeah.
terms of exercise, oh,
Well,
go ahead.
I was just going to say that, that is much more comprehensive than most people know. I think most people hear, what nutrients are important for eyes, and they know vitamin A. So vitamin A, they know what that is. But just getting the more broad list that you provide is very helpful, and also shows how expansive the need is for a nutrient dense, full nutrient dense diet. So that's amazing.
Yeah.
So, all right. So sorry to interrupt you. So moving on to
Okay.
exercise.
So first of all, whenever we do some vision therapy exercises, especially the ones that I've learned and promote, they are offering a way for you to develop more connection and relationship with your eyes. And so there is a physical connection, there's an emotional connection, there's a psychological connection, and even an energetic connection. So, one of the exercises that's really fun, and it will show people whether their two eyes are working together or not. And it's called the eye dialogue. Now, in this particular exercise, if you can do it, you do this in a safe environment, no demands on you. You can take all your glasses and contacts out. You're sitting in a chair, and you either cover your left eye or you use a patch, and you start tuning into, wow, what is my awareness when I cover my left eye? What do I see? What do I feel? And so you take maybe 10 seconds and really kind of register that. And then there are some questions that you can play a game where you ask your right eye, how old do you feel? And so it's very interesting to listen to what the first age that comes into your awareness. And it could be a child, could be old age, it could be I don't know, doesn't matter. It's just for you to start cultivating an internal relationship with your right eye. So how old is the right eye? The second question is really great. Right eye, do you know you're married to the left eye? And I've heard things from, in name only, we sleep in separate bedrooms,
Yeah.
or I didn't even know I had a left eye, or I'm feeling resentful because I'm doing all the work and the left eye. So
Wow.
there's a lot of things going on there with that when you start slowing down and you kind of feel somatically, psychologically what's going on there. So then the third question is, right eye, am I married to my body? Because the eye body connection helps us with balance and orientation and focus. So see where that is. And then the last question is, right eye, what do you need? What do you need that you're not getting? And you listen for that. Now, once you've done that, you take your hand away and you reintroduce the left eye, and you notice that things are now brighter and clearer. You've just released some energy in the right eye, and you're also now reintroducing the left eye, so it's got to recalibrate to the right eye. So there's a little neuroplasticity practice that's coming in there in that reintroduction. Then you repeat the same thing on covering the right eye, and you ask those questions with the left eye as well. And it could be a completely different story with the left eye. We don't know. And then you take your hand or the patch off the right eye and you reintroduce the right eye to the left eye. If you did this for once a day for 30 days, your eyesight would be a lot clearer, and you would be a lot clearer. You'd have a better relationship with your two eyes, because the major emotion that people have around their eyes is fear. I'm going to lose it. I'm going to go blind. I've been told I have this. Eye care is mostly a fear-based system. You go in and the doctor says, well, you're getting older. You got this. There's nothing you can do except surgery or drugs. So you walk out of there and you're like flabbergasted. Wait a minute, I study nutrition and they say if I do eat better, I'm going to improve my health. Why not the eyes?
Right.
So part of this is developing and cultivating a positive, healthy, inspired relationship with your eyes, becoming empowered. And so the eye dialogue is one of those really cool psychological, emotional exercises that impacts the physical. So that would be the first one to do. And then right after that, there would be a relaxation exercise to do where you're combining some breathing with some sound that you're going to put into the eye tissue. And why sound? Sound is one of the best ways to penetrate compressed tissue in the body. And you are making the sound, the person's doing it. So this is called the palm hum exercise. And what you do is you rub your hands together for about 5 seconds. You cup the palms over your eyes with your eyes closed. You take a normal breath in through the nose. On the exhale, keep your mouth closed, but make an audible humming sound so you can feel the vibration in your jaw, face, and eyes. So you do about 8 of those. And when you're done, after the 8th one, you take your hands away and you go into just a pause mode. You're listening now to what that sound and stimulation did for you. So there could be a temperature release, there could be better breathing, deeper breathing, there could be more relaxation. Something good is going to really happen from doing those 8 hums because it's vibrating this, and your hands are like tuning forks. So the sound is going directly into all the eye tissue. And then after you do that for about 30 seconds, you just listen. It gives you a chance to metabolize the stimulation you gave yourself. You open your eyes, and again, it's a recentering. It's a way that you will have more relaxation, more clarity, and you do that 3 times a day in between your screen time. After 30 days, you're going to notice that your nervous system is more calibrated, your vision is going to be more open, and you're going to have more clear eyesight. So these 2 exercises, you don't need any outside equipment. You just need yourself, self-awareness, discipline, and the curiosity of how can I learn more and cultivate my relationship to my vision better. So they're simple. They're all on my website. You could Google Eye Dialogue Dr. Berne or Palm Hum Dr. Berne, and you'll get a video. It's free. It's all free. So those would be 2 of those that I think could be really game changers for people who are really motivated to improve their eyes, vision, and wellness.
Yeah, that is one of my favorites, the palm humming one. I like doing that one quite a bit. It definitely reduces stress levels. It definitely helps kind of clear my mind. And I know it's doing something for my vision, but for me, it's a good mind clearing thing. So I use that one quite often. Well, that was amazing. Thank you for sharing those 2 exercises. And I know that you do have other exercises, other resources on your website. So can you talk about what your practice looks like now, and then a little bit about the resources that you provide on your website?
Mhm. So in 2016, I opened up an e-commerce store, and I started to move more into social media. I just saw that that would be a way to reach more people. And so we fast forward to today. I'm on all the social sites, and we put out about 4 to 6 pieces of content a day, all educationally based to help people. Some of it's research, some of it's practical information. So whether you do Facebook, Instagram, TikTok, LinkedIn, YouTube, Apple, iTunes, we do a lot of podcasts. And then my online workshops, I'm getting ready to do one October 7th to the 9th. It's called the Vision Sanctuary, 3-day online workshop. So if you're interested in that, I still do see some people either through telehealth or a handful of people here at the Geodome.
Mm-hmm.
And so it's kind of a combination of teaching the bigger groups and also doing the private one-on-one. It kind of keeps my hand into the clinical side of it. And then I have a new book that's coming out in February 2023 called Vital Vision. And I'm recording the Audible version now so that people can listen to the book as well as read it. So we'll be spending next year promoting the book. And the way I wrote that book was that we did research on what were the most popular questions that people had on social media. And so then we wrote the book based on what people were most interested in.
Mm-hmm.
Eye floaters, how to get rid of their cataracts, their nearsightedness. Anyways, it's very interesting how I put that together. And I think it'll really be a great resource. So
Mm-hmm.
lots of ways you can get in touch with me: audio, video, written word. You can always contact me at hello@drsamburn.com, and either I'll answer your question personally, maybe create a video blog for you, or answer it on my podcast. I also do live events, Facebook Live, TikTok Live, Instagram Live, so you can always hop on those sites, and I'll take your questions. So lots of ways to get me, and I'm here. So
Yeah, that's awesome.
just use me as a resource.
Yeah, that's awesome. Um, that is so appreciative, or so appreciated, that you do provide all that content. You are definitely a prolific provider of content. And I'm thrilled to be able to utilize your content. And then I was really thrilled to be able to come see you in person. So thank you once again for doing that. Well, this has been really exciting to talk to you. Is there anything that I didn't ask you that you think is important for people to hear in this discussion?
3 things. Number one, it's a great idea, I think, in terms of wellness, for us to practice self-regulation.
Mm-hmm.
Like that palm hum, you do it and you feel more relaxed. Like having that kind of a practice to self-regulate, I think is really powerful.
Mm-hmm.
Number two, I want to share with your community that you don't have to live out your doctor's diagnosis, that there are alternatives. And number three, you can improve your vision at any age, even into your 90s. I have a patient now who's 92. He reversed his wet macular degeneration and he's driving again, daylight driving. He went to motor vehicles and passed his driver's test. So don't let those obstacles stop you. And again, you can plug into my content. You can just type in anything you've got and something will come up that will be helpful or beneficial to you. So those would be my words of wisdom today. And I want to thank you for the work you're doing and for inviting me on today, and future collaborations, I'm sure.
Yeah. Oh, absolutely. That would be awesome. I'd love that. Yeah. And I can just, a little personal attestment. One of the reasons that I came to you was I was having floaters. And I definitely noticed that I don't notice that I have floaters as much anymore. It used to be very noticeable when I would read. Mostly when I would read would be the only times I would notice them. And now I'm not noticing them as much as I was before. So that has definitely been a big improvement in my vision. So thank you for that.
You're welcome.
All right. Well, thank you so much for taking time out of your day today. It's been a wonderful conversation. And as you say, I hope we can do some future collaboration. And I hope that our listeners reach out to you and see what kind of things you have to offer, because I know they're going to find benefit. So thanks so much.
Okay. Oh, you're welcome. Thank you, Diane.
All righty. Bye.